No, why did I
5,
start doing that? Freaking
4,
Joe.
You're trying to take Joe's job.
3.
Sure was,
Don't
and I
take,
don't
don't
want
take my
it.
job.
I don't want the
2,
job.
1.
Hey,
I
he will
think
raffle you for it.
We're
I
live.
think you do a job, Joe. You do a job, okay? I'm
That's
gonna leave
very
it.
PC of you.
Yes,
You do a
thank you.
job.
I do a job. Yeah.
Yeah,
Y'all
and you
don't
do
understand.
it so.
Y'all
job
don't
it.
You
understand.
just do it so.
Hey, you kind of tailed off there at the end. I didn't hear what you said there.
I finished. I said you
Due
kind
to
of so.
technical difficulties, he wasn't able to get it.
Oh no, those weren't
Yeah.
technical difficulties. That
I-
was
I
just straight up.
I don't understand what you're saying there.
Mama said if you can't say anything nice, don't say anything at
I was
all.
trying to listen, and I couldn't hear exactly
True.
what
You
you're
know?
saying. So,
Hey, Joe, that's a nice shirt there.
you like this?
I love it
You
actually.
like the merch?
Yeah,
I like your merch.
thank you.
That's a good.
I
that's a
know
good
y'all
message
are wearing
there.
nice merch, and I hear
Yeah.
I am plain Jane.
It's a really great organization to support. They're really
It
doing
is.
some fighting out there. Not fighting, really fighting, but just man, you know.
You know what we mean.
I know, you know.
Learn.
I know.
Learn about some.
You know what's funny? I do have to mention. I just feel compelled all of a sudden. I was like, man, sometimes when I do get looks, right, and it's got to be the strangest thing sometimes. So like, I get looks if I'm wearing this shirt, and people are like, "Huh, okay, that's cool, that's fine. You support and stuff." I'm like, "Yeah," but then sometimes if they see me with my wife, they're like, "Wait a minute, it just looks funny. It just looks weird." And I'm like, "Yeah, my last name's Pena too." They're like, wait a minute, what?
What are you saying?
I'm just saying, it gives people a loop sometimes, and it's like,
Yeah.
it's.
I
kinda
used
like,
to. So whenever my brothers and I would hang out, I would always tell them, "Oh, they're adopted." Yeah, it's fine. You don't have to give me the strange looks. Don't give them
Yeah.
strange looks. It's
So, yeah, you make them feel worse than they feel. Okay.
right.
Just,
Okay. They don't like it. Okay.
Makes them uncomfortable.
Hey, Miss Carrie Patton Jackson.
Carrie.
Official hello, everyone.
Hello.
We didn't actually
true.
do our
Oh
hellos.
my gosh.
That was the whole reason that I was doing the countdown for you
I'm
guys.
sorry, Miss
to make
Jackson.
sure. Ooh,
I am for real.
I am for real. I was like trying to play the song in my head. I was like,
That's what happens when you don't go to the club often back in the day with us.
no, it's what happens when you just barely wake up from nap number 2.
Oh
That's what
wow.
happens.
2 naps on a Tuesday.
And
On
I
a
worked.
Tuesday.
I worked like a good part of the day.
So
That's not-
11:30.
I was gonna say like 12
Hour
o'clock
lunch.
to 3,
That's
maybe.
not 11:30 to 4. That's a good day.
With
Good
the
part of
2-hour
the day.
lunch.
Yeah, there you go. How many of you guys have like 2-hour lunches and 5-hour work days? I'm just curious out there if that's like the norm. You know, that's
Hey,
the standard or what?
Don't be jealous, okay?
I'm not jealous. I'm
jealous.
just wondering. I am.
It
just
sounds like there's some
wondering.
jealousy in your voice right
Look,
there.
listen. I am happy to put in a full day of
Listen.
work. Okay.
Listen, Linda.
Listen.
I can
No.
feel it. I can feel it in your tone, the way that you're looking at me right now. You can stop. You can stop.
On a better note, do we have a business, Sandy?
We do have a business.
Is it
And
something
I would
you want me to share real quick, or do you need a couple seconds? Do you want me to
I
fill
do
the
need a
time in?
couple of seconds. Please fill some time.
Absolutely,
here.
absolutely. So, Joe, how was your day?
It was great, but I have a service that I just signed up for.
Oh, tell us about it.
Yeah, it's called Curiosity Stream.
Oh, I've
It-
heard of this.
so-
Tell me
I'm
more.
curious.
Yes, so if you
I'm
love
streaming.
um,
I really am streaming.
if you love documentaries, this is the streaming service for you. And so they have all kinds of documentaries, a whole bunch. They have them divided into science and food and dinosaurs or animals and stuff like that. So it's really a cool service, and it's $20 a year.
Really?
Yes, $20 a year, and so it's really a cool thing. And I have a personal link, so if you want to sign up, I'm going to put it in the comments, and that way I get something out of it. No, we both get something out of it, but mainly me.
Right. You get to use me.
It's a referral link, but it's really nice. It's really nice. Oh, sorry about the business of the day, but that was my service of the day.
That's okay.
Okay, so my business of the day is Butterfly Kisses Floral and Gifts. They are located in Morton, Texas, and they have a website, Floral. It's butterflykissestx.com.
I got you, Sandy. I got you.
Awesome. Thank you. They have fresh floral, women and children's clothing, custom-made t-shirts. They have monogramming, hair salon, fitness
that
center,
looks
tanning
cool.
beds. It's gift items for all ages, custom-made gift baskets.
And
So-
they have a Father's Day link right here. Father's
Hint.
Day flowers.
Hint,
Oh,
hint.
awesome. So I order from her frequently, and I mean, I love online shopping. I have a problem, but
I saw the TikTok.
Yeah, we know.
so anyway, this is just from my little hometown, and I love to stay local and help out wherever I can. So if you can, she's got the cutest thing. She also has a Facebook page, and she always has sales, and she even has like subscription boxes for her stuff. So anyway,
Really?
yes, y'all go over there and give her a like and a follow because she has amazing things there.
That is awesome. So did she name it after the song?
I didn't ask her. I totally should have.
Can't do that. I can't do that song.
I can only listen to that song one time because after that, it's tough to listen to. Yeah.
The girls used to mess with me. They're like, "Daddy, this is a cute song. What is that?" I'm like, "Stop!" And they'd be like, "We want to listen." I'm like, "Okay." And I'm like, "Oh my god!"
Okay, so I found her Facebook and I put it in the comments.
Nice,
Awesome.
nice. And I put my streaming service of the day. So,
And what kind of documentaries, Joe?
I'm on it right now. Let's see here. If we go to collections,
Murder mysteries.
They have so of course, if you don't have anything narrated by David Attenborough, then it's not
It's not legit.
It's not legit.
Not for real.
But they have some for him. Ancient Earth, award-winning shorts, breakthroughs, Early Man, History Mysteries, Secrets of WW1, Rise of the Machines. They have all kinds of cool stuff.
They have
there.
Secrets of WWF.
Not quite.
World War Free
Yeah, lifestyle
of the rich and
performing
famous.
arts, health and fitness society. So they get some cool stuff here. So
That's great. Sandy, how was your day?
Okay, so my day was awesome, you guys. I perfected, but we perfected our chicken salad. It officially tastes like the one at United that we used to buy before we went GFDF, SDF. I mean, I was so excited. And then I typed in, because I do my groceries online shopping too, to do the pickup because it's so much easier.
yeah,
Anyway, so I picked up some gluten-free crackers for my salad. I can't even tell you how excited I was. It was delicious. And I'm like, yes, we hit the spot with that. And
Nice.
so that just made my day. And I felt like, oh my gosh. And then I read a story today.
What
I don't
is
know if
it?
you guys have heard about it. There was a guy that hid a treasure in 2010
Yes.
and wrote a book about it. And
Yes.
people have quit their jobs. People have died looking for this
Yes.
treasure. And a few days ago, someone finally found the treasure.
How much was it? It was like millions, right?
It's like 1 or 2 million.
Okay. I
Because
thought
it's like rubies, it's gold, it's all these things that he put in this, wrote a book about it. And anyway, so I just thought that was amazing. I'm like, gosh, I wish I would be reading books and I could find treasures.
right. Now the only thing left is to find the treasure of Oak Island.
What do you mean? There's another one?
Oh, Sandy, we'll talk about it in the after show.
Okay.
I'll put that in the notes real quick so I can remember to come back to it later.
Okay, cool.
Oak Island.
Sandy, you are from Morton. That's where I live.
I am from Morton. Linda Arthur. Oh my gosh, yes. So my brother is Frank Rodriguez.
Shut
So
up.
you might know him.
I don't know why.
Oh, I thought you said shut up, and I'm like, okay.
No, I would never say that to you or y'all.
Okay.
I said shut up. I don't know why. Hey, Priscilla.
Hi,
Thanks
Priscilla.
for coming in. Joe, how was your? Oh, you already said you had.
I already said my day. Yeah. So you have 1 minute for your day.
Okay, my day was it was raining. Oh, they came to pick up the lawnmower today because the riding lawnmower because I couldn't fix it. I think the transmission might be out, but they're gonna let them say that. So that happened, and
Well, now
they
you'll
came
have to
home.
hire somebody. Darn.
Yeah, we'll see.
Mhm.
I made a super awesome dish tonight that I was really excited about. I will show you on Friday what I made, and I'm not going to keep it a secret because I was excited to make it. But I made some carne guisada today.
Oh, really? I've
Yeah.
never attempted carne guisada.
I've tried it too many times, Sandy, and I can't get it right. And today was no different. But it's still edible and it still tasted good. It's just not. Yeah,
It's not Jamie right.
it's not Jaime right. So listen, anyone from Josie's, if you're listening, I need you to ship me some carne guisada in one of those large buckets that y'all have with it, and I'll warm it up over here, okay? I'll figure it out. Just send it to me.
See, I would ship it, but you've never shipped a dessert to me. So
I know that's right, girl.
it ain't
Don't
happening.
even be asking us.
Yeah, don't even ask us to do that because it ain't happening.
I might need to know. I might need to know someone to make it for me and send it to you. If that's
Hey,
what's gonna
Jamie.
cost.
Hey, Jamie.
Yeah,
Who's on our show tonight?
guys, I have a doctor. This is crazy. It's kind of cool because it's our first doctor on the show, so I'm kind of like, it's a little weird having a doctor come on tonight, but that's who I got. And so you remember some weeks ago, we had Kellyanne on, and she was our first nurse practitioner. And so she told us about her episode she wanted us to do was on ketamine, on wellness. And so she introduced us to someone, and his name is Dr. Cannon Clifton. Okay. He's a board-certified anesthesiologist. He completed his residency at the University of Texas Health Science Center in San Antonio. Whoop, whoop. This man doesn't just have his medical degree. He just doesn't have his MD. He's also a licensed professional engineer in the discipline of chemical engineering. I can't wait to talk to him about what that means because I have no idea, but my brain is like, oh my gosh, I'm sure this is going to be a lot of stuff. I mean, a professor of chemical engineering. Yeah, maybe he can really dose up some THC medicine for us up here in Illinois. Anyway, so he's a part of Kalypso Ketamine Therapy, and ketamine, guys, I've heard that before, but he uses it in medical therapies. I don't know if therapies is the right way to say it, but
He uses it for the good.
yes, he uses the good stuff. Okay. Well, that doesn't help out either, does it? Right. We're just going to let him
Why don't we just let him explain it?
Yeah, let's just do that. So, guys, help us welcome Dr. Connor Clifton to the show tonight. What did I say? Connor Clifton. Cannon. Bring it on, Dr. Cannon.
Dr. Cannon, so sorry.
Hey, everybody.
He built you up, and then he just butchered your name, so we apologize for that.
So, listen, for the remainder of the show, I'm going to call you Dr. Cannon, okay? So, because that name is so cool. I love that name. So,
I think he has a story about his name.
Oh, that's right.
We do have a story. I'm actually the second son of my parents, and our dad was in the military and initially flew attack helicopters, air cavalry, but then transitioned to artillery division. And he helped invent a nuclear artillery cannon for the Vietnam War. And so he named me after part of the invention that he helped design.
I love that.
Wow.
He built a nuclear cannon on a boat?
No, it's artillery cannon, so it'd be on the ground. Now, of course, they never used it in the Vietnam War or conflict, but definitely the design is out there.
What?
To confuse things even more with my name, technically Cannon is my middle name, and that's what I go by. But my first name is the letter J, not J-A-Y, not J period, just the letter J. So anytime I've got to fill out any government form, get my license, my passport, TSA check-in.
You're like, no initials, and you're like, no, it's not an initial.
It's terrible every time. And then, when I fill out forms, if they want last name first, I put Clifton and then a comma, and then if I put my first name, the letter J, and then
that's got to be terrible.
And to make things worse, my brother is also an anesthesiologist and a partner of mine, and we can be standing next to each other. His name's Brian, right?
Okay.
So his name's Brian Clifton. My name's Cannon Clifton. We can be standing right next to each other, and another doctor, a nurse, a technician, somebody will walk up and they'll be like, "Hey, Dr. Clifton. Hey, Dr. Cannon." We'll be like, we're brothers. We gotta have the same last name.
I can see that. That makes sense. But if I had a doctor named Cannon, like, it'd be hard not to just be like, yeah, I'm gonna still call you Dr. Cannon.
Right, exactly.
Hey, I've been called worse. I just answer to anything, so it's all fine.
Even better. Dr. J, period.
Yeah.
No period. There's no period after.
No period,
Joe. So, Kellyanne has suggested you. She came on our show a couple weeks ago and wanted to further promote the whole wellness and things. And so why don't you tell us a little bit about yourself first before we get into all your professional work that you do?
Okay, so we talked earlier when we were in the green room that we wanted to break the ice a little bit. So we're going to be talking about some science stuff, some medical stuff, but I got to tell you guys what my guilty pleasure is. And my guilty pleasure is I love reading fantasy books. I'm talking wizards, dragons.
Nice.
Oh yeah, I'm all in. I'm all
Okay.
in.
Game of Thrones, then. Game of Thrones.
Oh yes, love Game of Thrones. The books are awesome. The shows are awesome. And Harry Potter, Lord of the Rings.
Rick Riordan.
Oh yeah. So
see, yeah,
Percy. Yep. So it's kind of funny when people meet me and talk to me, and then I throw that out there, and they're like, well, you got the science background, this medical background, the engineering background, and I'm just a sucker for if I could invent to bring magic back in the world, I'm your guy.
Right.
You're like, I'll be first on there. I'll help it. I'll help. Yep.
That's awesome.
Yeah.
Didn't you hold up a book when Sandy was talking about her the treasure that was found? I thought I saw you.
Yeah, Sandy, you ruined the end of the segment when I was going to give a shout out, and I was. So here's the book she was talking about. All right.
The Thrill of the Chase.
So The Thrill of the Chase by Forrest Fenn. And Ian and my brother have been studying and reading this book for years.
No.
Are you serious?
Our notes.
Oh my goodness.
Right? There's a map, our notes. And so, the whole deal was that this guy was a art collector in New Mexico. And when he was growing up as a kid, he was kind of, self-educated, didn't like formal school, and loved going out fly fishing and loved the outdoors. And after he kind of got himself successful, he decided, hey, I want to encourage other people to get outside, to be outdoors, to do more things. And this was kind of going to be my shout out we got all these iPads and phones and computers. And I wanted to say, in the spirit of his treasure hunt, that, I got small kids too. I can't encourage people enough to be getting outside and doing things.
Yes.
And so he hid a box that was filled with, as Sandy said, rubies, gold coins, ancient Indian artifacts.
Gosh.
And he wrote this poem. And, he said very clearly, if you just follow the poem, and if you study the poem enough, it'll tell you exactly where to go. And the only clue he kind of gave was that it's somewhere in the Rocky Mountains between New Mexico and Wyoming. And so obviously that's a huge bunch of land.
Yeah. He was pretty specific there, huh?
It's just 3 states.
Sandy said that somebody found it, and the author, the guy that hid it, he's 89 years old. He confirmed, because he got sent pictures that somebody found it, but they still haven't said yet where the guy found it at. And so I'm waiting with bated breath to see if it was one of the places on my notes that I was going to go out and go look for. So
wow, that is so awesome.
That would be cool. Yeah, I saw him talk about it this weekend. I saw the YouTube interview or little segment that they had on him, and I was like, oh, no way. And it's been like 10 years. Yeah, like I said, 10 years.
Yep. Yeah, it's been 10 years.
Man, that would have been fun to participate in.
Yeah. No, I wish I didn't make the time. And of course, I wasn't going to go out there until I thought I was, had a really good idea of where to go. And but I've been waiting to. I mean, they're probably, I'd say probably at least once a day I would look at his poem just to try and see what would jump out, and maybe think of like movies like National Treasure and the Da Vinci Code. And if you figured out the clue right.
It's
genius.
And I first heard about it when he did it, and how many people were going out there and doing it. And then over the years, I've kind of quit following. But man, when I saw that headline, I knew exactly who it was, what they were talking about. I was just so amazed. But I'd love to see the pictures of what he put out there. That'd be pretty cool.
You will have to do a Facebook Live, Doc Cannon, on your notes and everything, and when the location is revealed, to make sure it's the legit stuff. And then just share with us all, because I would love to just hear you talk about it.
Yeah, because
he's
got all kinds of notes there.
That's so awesome.
Yeah, that's so cool, Sandy. I'm glad you brought that up.
I told you so. Like I said, wizards and dragons and treasure hunts. I'm just a big dork. I'm a big dork at heart.
All right. We need to get to the good stuff. That was good, but we need to get to the better stuff.
We want to hear about you, though. Because next you're going to tell us you've been looking for DB Cooper's money too, right?
It's out there somewhere.
It is. It is.
It's at a stream in Oregon. They found pieces of it. I've researched it.
Yep. There's that website you can go to, and you can still put your dollar bills in and see if it was part of DB Cooper's stash or not.
Right.
Yeah. So, okay. I'm sorry, Joe. You wanted to get onto the other stuff.
No, that's
Right.
okay. That's awesome. That's awesome. So we do need to get on to the actual what you do as far as a doctor part.
Yeah, that would probably be good. So, all right. So, Doc Cannon, you gave us a little bit about yourself, but help us understand. We are uneducated when it comes to ketamine and its benefits. So, why don't you tell us how did you get started onto the medical field in the medical direction, and then what eventually landed you into, I guess, is it safe to say, like, specialty in ketamine? Is that how you say
Correct.
it?
Yep.
Okay.
And so, as you mentioned at the beginning, initially I was a chemical engineer and actually worked at an oil refinery for about 5 years. And at the time, I was married, but we didn't have any kids, and I just hated my job. I love the math and the science, but the computers did all that now, and I was like, man, I'm too young to be hating my job. And so at the time, my brother, he's my older brother, he was in medical school down at UTMB in Galveston. And I started talking to him, and because I knew I still want to do something, science related, but I want to do something more to help people. Somebody was going to have to make the gasoline. It just wasn't going to be me anymore. And my wife actually said, hey, have you realized that for the last month, all you've been doing is trying to figure out how to get into medical school? And so decided to move back to Texas. I was living up in Minneapolis, actually just south of the Twin Cities, and applied to take some biology prerequisites and applied to med school and did medical school at San Antonio, as you mentioned. Whoop whoop. And, decided to specialize in anesthesiology, and part of that I think is because, again, my older brother decided to specialize in anesthesia, and so I think being brothers, we're like-minded and we talked a bunch. But when medical students are picking which specialty they want to go into, there's lots of factors, but usually it comes down to kind of a lot of what your personality is and what things you want to focus on and specialize in. And the role of an anesthesiologist is we've kind of got to know a little bit about everything, because it doesn't matter what surgery you come in for, everybody's going to have different problems: high blood pressure, depression, cancer, diabetes. But we also wanted to be in the operating room, and we also like to do some procedures. We intubate patients. If you ever had an orthopedic surgery, we're the ones that do the nerve blocks to help out with the pain for afterwards. And the other benefits of people that go into anesthesiology is that we love knowing about all the pharmacology, so all the drugs. We have to be experts in knowing almost all these drugs, because every patient is taking anywhere from 1 to 20 drugs, and they're all different. And so we love the aspect that we've always got to be knowing what they're taking and how that's going to interact with their anesthesia, with their surgery, with what's going to happen after their surgery. And so I as well decided to do a residency in anesthesiology, and then went into private practice here in San Antonio and stayed here. We've been here since 2001 now, and been working as a full-time anesthesiologist.
And let me ask you real quick. The anesthesiology, that's like, I remember when my wife was delivering the baby, and is that's the same stuff that they put whenever they wanted to, like, numb her the bottom half of her body kind of thing and whatnot? Is that the same thing?
Yep, that's what we do. That's called getting an epidural, and I love
talking. I call it getting bows on my head, because that's what she did.
Right?
Yeah, so, if my Dr. Pineapples is watching, she remembers what I'm talking about right now. So
you don't want to get me going on epidurals, because there's so much false information out there about epidurals, and it's an interesting phenomenon, because clearly I'm not a woman and can't ever have a baby, but it doesn't matter which woman comes in here, everybody, almost all of them, say, well, I want to see what it feels like a little bit. And nobody says nobody's going to get their gallbladder taken out and says, oh, I want to feel it for a little bit. And then, right? But yeah, most of the time it's people are worried that it's going to cause, long-term back injuries, or there's problems with the spinal cord. And just real briefly, for all our viewing people that might be getting epidurals at some point, we actually put the epidural below where your spinal cord's at. So it's a physical impossibility to hit your spinal cord. But yes, that is the person that did your wife's epidural was an anesthesiologist. So yes, we do that too. And
okay. I just wanted to make sure I understood anesthesiology. That was the same. I'm in the same line with you. I'm following you.
It's one of the things that we do, correct.
Okay. All right, cool. So you were saying about ketamine. You were about to.
So fast forward after we started private practice, and maybe 5 years ago, I came across an article that was written talking about the benefits of ketamine helping veterans with PTSD and depression. And I'm reading this article and I'm just blown away, because even though as an anesthesiologist, we use ketamine pretty regularly, I'd never heard about it being used as such an effective medicine for PTSD and depression, and showed the article to my brother. He read it and, he thought it was fascinating. And then our other two partners at Kalypso, which, we'll get to later, they're actually anesthesiologists and then further specialized in traditional pain management. And they said, oh yeah, we've heard about this, but we don't have time to, do this with our normal day. And so, I said, well, hey, I'll take some time off from my anesthesia work, and, let's look at, because it also helps patients with chronic and severe chronic pain. And so we said, hey, some of your patients, if nothing else has worked on, they've tried steroid injections, they're maxed out on opioids, and, everybody's heard we are in this opioid epidemic. And we're trying to help these patients get off these debilitating drugs. And so we said, let's look at some of your worst patients, and the literature supports the use of this medicine. And sure enough, we tried it, and 7 or 8 out of the 10 patients we used said, oh my God, I've never felt this good in my life. The problem was, and I'm going to ask you guys in a second about ketamine, but the problem is that literally half of them said they would never do the treatment again. And that's a problem, right? And we have a joke in medicine that if I invent a cure for cancer, but it causes Alzheimer's disease, that's not a very good cure for cancer then, right? So kind of the same thing with the ketamine is if it helps 7 or 8 out of 10 patients, but half of them say you'll never do it again, well, then that's not really a good medicine either. So my question for you three real quick is, and because I love talking about this, is just briefly tell me, what do you know about ketamine? And it's usually 1 or 2 answers. So hit me with it.
Special K.
Yep. Anybody else?
I have to follow. I didn't know it was called Special K, but I thought it was a drug. Yeah.
What'd you say, Sandy?
Drug.
Yep. So usually when people hear about ketamine, it's 1 of 2 things. They hear that it's a, kind of a rave Special K party drug, or they tell me it's a horse tranquilizer. And the answer is yes to both. Obviously anybody can abuse any substance, alcohol, codeine, pain pills, doesn't matter, Special K. And the difference is obviously you're in a medical setting. We know what we're doing with it. It's much more controlled dosing. But the other one that most people get worried about is I hear that it's a horse tranquilizer. And that sounds really bad, right? Because horses are big and they must be super powerful. And the reason why veterinarians use it all the time is because the same reason we use it in children a bunch. Both animals, especially big animals, and children don't let us start IVs, right? Nobody likes to get needles.
Right.
So ketamine has a unique property that as an anesthetic, you can give it intramuscularly. So you give it like a flu shot, and then you wait 15 or 20 minutes, and then the child or the animal starts to calm down and relax. And then you can then start an IV or do whatever you're going to do. For kids, it's usually something like setting their bones if something's broken, or if you've got to put in some stitches. For the animals, it's obviously you can sedate them more.
Yeah.
But the difference is it's all dose related. And ketamine is also super unique in that it's our only anesthetic that actually increases your heart rate a little bit and increases your drive to breathe a little bit. Whereas all of our other anesthetics, if I give them to, doesn't matter, horse, pig, kid, adult, once we give those anesthetics, then your heart rate and blood pressure start dropping and you quit breathing. And unless somebody's there like me or emergency, physician, doctor, then unless we can start giving you oxygen, put a tube down your throat, give you a mask or something, then bad things are going to happen. So that's why ketamine is super interesting, because it's
the opposite,
actually the most safe anesthetic that we have.
It's like an upper anesthetic. It makes your blood go up instead of like your system go down. Like you'd think with an anesthetic would slow you down, but this one actually speeds you up.
Does a little bit. And the other neat thing is that where we use it a lot too is going back to talking about epidurals, is that if women have an epidural and let's say they have to have an emergency C-section, sometimes the epidural doesn't work well enough when you have to, do an operation now and cut open, the mom. And so we can give the ketamine because whatever the mom gets in her IV is what the baby gets. And so since it actually kind of perks things up a little bit, the baby comes out a little spunkier, not as floppy. We don't have to worry about doing CPR right away. And so it actually is a really good in that scenario as well. So the difference now is that getting back to what we do with it at Kalypso is that we're given in it in what's called sub-anesthetic doses. So it's called low dose ketamine. And going back to my original story, when we first started, using this on patients, and the problem is that the ketamine is still a super weird drug. And it's weird because it causes these dissociative types of symptoms. So colors look altered, you have weird kind of thoughts, you may, kind of feel like you're floating. And the problem is that when you get it raw or just straight ketamine,
Mhm.
those symptoms are very not good for the patients. They don't like them. And so usually when we give it, whether it's to kids or animals or for the pregnant moms, once the baby's out, we usually give another medicine that causes severe amnesia. So that way they don't remember having this kind of weird flip out things, right? So
I'd bypass the second one and be like, just leave with the first one.
right?
I've always wanted to fly. That's just me. I'm sorry. I'm being honest here.
So what we did was we went back to the drawing board, and as you mentioned earlier, my background is chemical engineering, which I'm a professional engineer. One of my partners has a master's in pharmacology. My brother, who you've heard me talk about, I say this affectionately, he's just a research nerd. He just reads everything, literature. So we went back and started looking not just at the medical literature, but also the organic chemistry literature, physical chemistry literature, old drug-drug interactions. And we came up with new formulation that not only now enhance the ketamine. So the literature out there shows that if you get a normal kind of ketamine infusion, about 70% of patients report that they get the benefits they want. Our data now, and we've done over 8,000 infusions over the last 4 years, is our benefit rate is 90%.
Wow.
And perhaps more importantly, again, the medical literature out there is that, again, it's about a 40 to 60% side effect rate for patients to have these terrible hallucinations, these bad dreams, terrible headaches. They feel out of it for days, whereas our side effect rate is now less than 5%. And so,
wow,
very safe now formulation. And in fact, they're patent pending because it's so revolutionary to not only ketamine, which is a disruptive technology in the space of chronic depression and chronic pain. But with our formulations, we're actually disrupting the disruptive technology. And, we're actually waiting to hear any time now from the, United States Patent and Trademark Office to see, how that works out. And it looks very promising right now. So we're super pumped about it because,
wow.
we just want to get this therapy out to many more people.
Dr.
Sure.
Cannon, that's amazing.
Yeah, that's crazy because I was speaking to the producer about you coming on, and she said she had heard all of these things about ketamine and wasn't sure about, just not sure about it at all. So just to kind of hear you clear all that out without me asking any questions is kind of cool. So I think that's really, I think it's eye opening, definitely.
But speaking on the producer part real quick, she is asking a couple questions, Doctor.
Hit me with them. Hit me.
So she's saying, does the treatment last before you have to do another treatment?
So what we found, and this is most of the medical literature too, is that people that have chronic pain, chronic depression, anxiety, PTSD, migraines, etc., is that if they've had it for some length of time, and most of these patients that come to see us, because they only come to see us after nothing else has worked. They've
Right.
tried every other doctor, every other therapy, every other treatment. And so we know now, again, having done over 8,000 infusions, that people need 4 to 6 treatments, and they usually get them within 3 to 4 week time frame. The benefits seem to be the most effective if they get treatments once every 10 days or less. And so what normally happens is they get 4 to 6 treatments over, again, like I said, 3 to 4 or 5 weeks. And then patients are great for 3 to 6 months. And then they may need another booster or maintenance treatment around, again, 4 to 6 months. And then maybe again at 8 to 12 months. And then after that, they're doing awesome. Good night, baby. Family's awesome.
She said good night and bye.
There you go. So obviously every patient is different, and in medicine, unfortunately, we can't guarantee anything. I keep bringing up these medical jokes. Is that another joke in medicine is we're the only practice that we're trying to put ourselves out of business, right? If I had a magic pill to cure everything, right, nobody comes see me anymore. And
right.
You know what? I'd be 100% happy because then we fixed everything. But
so, Doc, that you mentioned that, and that's actually the other question that she had was, anyone working on a pill form for this?
So they do have a pill form of ketamine. They also have what are they're almost like cough lozenges, and they also have a nasal spray. The problem is with the pill form is that you don't absorb as much of it. And again, being a controlled substance, we worry about prescribing it for patients to take home with. As we mentioned earlier, anybody can abuse anything.
Right.
If you have a surgery and the surgeon gives you 10 Vicodin to go home with, if you take all 10 at once, things aren't going to go well.
Right.
The nasal spray is actually a new thing that Johnson & Johnson came out with, and it's shown promise. The problem is that when you take a nasal spray at maximum, you only have about a 30% bioavailability, which means the medicine that you want to get, you're only going to get 30%. And that's if your nose isn't stuffed up at all. So the difference is when you get an IV infusion, is that you're getting 100% of it. And we're able to incorporate our formulations to make sure that we increase the efficacy and decrease those side effects. For a pill, they don't have that yet. For the nasal spray, they don't have that yet. We're actually in works to make our own nasal spray, and obviously you have to do testing and studies, et cetera. But the benefit is in that some patients that they do great with the IV infusions, but then maybe in 3 or 4 months, unfortunately, life happens. You get re-injured. Your favorite parakeet dies, something happens at work and you get depressed again, right? They can come in and maybe
when that happens,
spray and get them through without doing a whole infusion again. And I should point out that infusions take exactly an hour. You have to start an IV. There's some paperwork to fill out, and then afterwards we keep you with us for 15 to 30 minutes to let the immediate effects wear off. You definitely have to have a driver to take you home because you're going to be a little impaired. We tell everybody, not to drive, not to sign any documents or make any life decisions. But by the next morning, they're back to normal. And if you have a morning infusion, people go home and nap. By the afternoon, they're back to normal too. So relatively quick.
There's so many questions I have right there, but I'm going to let the producer ask because mine I don't think are going to be pretty cool. She says, does insurance usually cover these treatments?
And that's the rub, and that's what we're all fighting for. Is that ketamine is relatively an old medication, and so it's what's considered a generic medication. And so it is FDA approved to be used as an anesthetic, as I talked about, and the vets use it. These low-dose ketamine infusions, and not just Kalypso is doing, but lots of other ketamine providers, is considered off-label FDA use. That sounds scary, but it's not. We use medicines all the time, probably thousands of them that are considered off-label use. But the issue is that insurance doesn't cover it because Medicare and Medicaid only will cover things that are considered FDA approved. So the problem is, if we go back to what ketamine is now a generic medicine, is that to do true studies now, which are called double-blinded, placebo, randomized controlled studies, these big pharma companies have to spend sometimes upwards of $150 to $300 million. And obviously they want to get a return on their investments. And the problem is that ketamine is generic, is that, drug company X does all the studies and spends, hundreds of millions of dollars. And then they show that it works, which we already know. The problem is that they can't ever increase the cost of it because I could just go buy it from drug company Y and buy it significantly cheaper. So what we're hoping is going to happen is that there's so much anecdotal data, there's so much more publications coming out about it. We actually at Kalypso have partnered with a lobby group in Washington, D.C. and have been up there to talk with congressmen and senators to tell them, hey, here's what we got. This is really helping, not only our veterans, but, patients that suffer from depression, patients that have these opioid problems because they can't get rid of their pain. And to be honest, ketamine wasn't even on their radar. They never even heard of it. And so we're trying to push that, hey, we've got the solution and we want to set the standard and make it safe for everybody. And hopefully we're going to have enough of a ground-swelling support that, that they're going to have to say, all right, we got to start covering this. And so unfortunately, what happens is patients can come in and, you can have insurance bill for the office visit, and there's a generic code for getting a generic infusion. And sometimes we may or may not get an EKG, but the problem is that it still doesn't cover for the cost of getting the infusion. So if insurance covered it, to answer the producer's question, we'd have a waiting list of, 3 to 6 months. And so unfortunately, people have to pay cash. We've got certain programs set up to try and help these patients because we want to get it out there to them.
Right.
We've got discounts for military, veterans, first responders. And, again, we try and make it as accessible as possible. And still, obviously, we still have to run a business. But, we want more people to get this treatment for sure.
You should include state worker. She's a state worker, so she'd love to hear that.
State workers?
Yeah.
We'll hook you up.
I had 2 questions on that. With that, I don't know how to ask this. What's the going rate for an infusion of ketamine?
So it depends on what state you're in, and then also depends on, the specific clinic, so to speak. For us, the average cost for one infusion is around $350. And again, it depends on, since we know patients are going to need 4 to 6. We got packages set up for them. We also have, you can think of it as like a gym or tanning membership. Do they still have tanning memberships?
They do.
I mean,
Yeah. Okay. I live in South.
I think
live
you're
in South
asking the
Texas.
wrong people.
I live in South Texas, so I just go outside. It was 100 degrees
Right.
today.
Oh yeah, it was. Yeah, it was brutal today.
But we have it set up so they just pay a monthly fee, which is relatively cheap, and then that way they can get their infusions over a year, and still keep it safe and economical for them. So, but depending on the state, it's different. And at Kalypso, we actually have a total of 10 managed partner clinics that we kind of oversee and support. And so, depending on where they're at, the prices will be a little different. One of our facilities that we partner with is up in Long Island, New York. A little more expensive in New York. They charge a little bit more. So it just that depends too. And I've seen prices as low as around $250 to $300, and some people are charging several $1,000s. We think that we are very competitive and very reasonable. And again, with our patent pending formulations, we think you're getting the best product for a reasonable rate.
So let me ask this. I have a friend, for example, who, because I noticed, I went to your website and was looking at, and one of the things that kind of reached out to me that I thought a lot of my people in my circles could benefit from is the migraine, the headaches. I have a few friends who I know, I've never had to deal with migraine, but from the way that they describe it, they're absolutely debilitating, and sometimes over days. And so I know of a friend or two that it is not just a chronic problem, but it is one of those debilitating things that happens, it takes them out for days at a time sometimes. I know it's a loaded question as far as, there's a lot of things that can contribute to migraines and headaches and whatnot, but taking your clientele, for example, which you see a majority of, how does ketamine help out with those folks who've come to you struggling with migraines?
So I'm going to add into migraines too another disease state called fibromyalgia. And the reason I bring both of those up together is that even when I was going through med school, starting back in 2001, the medical community kind of, people with migraines and fibromyalgia, they're making it up, right? And that was kind of the dogma that we were taught. Man, maybe there's some real things and there's some stuff going on, but can a headache be that bad? For people that don't know about fibromyalgia, these are patients that have weird pain. It's usually, multiple different trigger points, and nobody can figure out what was wrong with them. But once we started doing these ketamine infusions, and I started seeing these patients, as you're mentioning, that have these true migraines and fibromyalgia, you're exactly right. It's 100% debilitating. And I would see these patients come in. They couldn't look at you. They couldn't talk to you. They have dark sunglasses on. They don't want you to touch them. And so with these treatments, it's revolutionary because the difference is that all of our other pain medicines, are essentially mostly derivatives of some type of morphine. And this is where I'm going to get a little technical and nerdy, but just to make
Please do.
Morphine and most of its other derivatives, they work on some major receptors called the mu and kappa receptors. Ketamine is unique in that it operates on a different pain receptor called the NMDA receptor. So when patients get exposed to these ketamine infusions, it's the first time their body's usually ever seen it. And they're like, wow, what was that? And so the problem is that when patients have chronic pain, migraines, fibromyalgia, neuropathy, et cetera, is that the body keeps sending this signal that says, hey, I'm in pain. And even though things have been fixed, you get caught in this vicious loop. And so the ketamine helps to block these receptors, make them start feeling better. And this is the coolest part about ketamine is that what we hypothesize that's happening is it actually helps to what we call neurogenesis. So it's helping new nerves to regrow and attach that now don't have the memory or the imprint of saying, I've got to have this chronic pain anymore, this chronic depression, my anxiety, my PTSD, my migraines.
Are you serious?
It's crazy. And I could go on for hours about stories that patients come in that they say, oh my God, you got my life back. You got my wife back. I can go to work again. I can't believe that I don't have a headache for a week straight anymore. Nobody believed me. And all of a sudden now that, I've gone back to nursing school for my fibromyalgia. And so, for the appropriate patients, this is truly life changing. And yeah, we had some business people that helped us out with the business side of it, and our slogan is reset for life. And that sounds kind of cheesy, but I can't. That's what happens. Is
Yeah.
If I have a bad day at work, I go into our Kalypso office and go see some patients because we get these people coming in just telling us how much that their life has changed, and they can't believe it. We got women that come in their walkers, and they're able to get their treatments, and then all of a sudden they can go garden again. We got men that have been suffering from PTSD from whatever conflict they were in with the military, or maybe they're police officers, or they suffered a trauma when they were a kid, and all of a sudden now they can start going back and living their life again. And and the biggest thing is we want people to get off these other medicines. All these pain medicines, all these antidepressant medicines, they were meant to be short-term fixes. They weren't meant for people to stay on them for years and years and years. So that, to me, that's the most exciting part is when I get just one patient that says, you changed my life, doc, and that's the reward. That's what we're doing.
That's pretty cool.
Doc, I want to pause you for just a second, if you don't mind. There's a couple of comments that have been coming through. I kind of want to make sure they have some time here because they're joining us tonight. So Erin came in and she said, this is back to your pricing, what you were saying earlier. That is a great price. I spent at least $3,000 plus on migraine medicine in 1 year.
Wow.
Erin, I'm sure that's something. So, and I know something that would allude to maybe something in Erin's next thinking is, and kind of the question I want to ask later. I'll ask it right now just to kind of get the juices flowing for everyone. How do we get ketamine when we're not in San Antonio? We'll come back to that in a second. Actually, yeah. But Linda's saying lots of my family have fibromyalgia. This might be something that we all need to check out. So I think actually the questions are kind of gearing towards that direction is, what do we do when I'm up here in Illinois. I don't know if I had mentioned that before, but I'm in Illinois. Joe and Sandy are both in Lubbock, Texas. What do we do for those of us who don't have a Dr. Cannon down the street from us?
So for Kalypso Wellness Centers, like I said, we have 10 partnered clinics throughout the United States. You can certainly go to the website. It's just calypsowellness.com and see where we're at. The other good news is it's even 4 years ago, the best of what I can guess, there was maybe only 20 or 30 clinics in the whole United States. And now there's got to be several hundred, if not maybe 1,000. And so, just go to your whatever browser you're on and Google ketamine infusion therapy. And there's going to be clinics that pop up close to where you're at. There's some, obviously, we think we have the best formulations. It's not just raw ketamine, and have the best protocols. And that's obviously why we tried to patent it. But again, even if you weren't coming to a Kalypso clinic, and this medicine needs to get out to patients. And so, people are getting 70% of patients are getting better just with quote unquote generic ketamine. And that's phenomenal. If this was not a medicine that people think of as Special K or as a horse tranquilizer, this would be all over the news. I mean, this would be a total game changer.
Right.
You just don't hear about this. And if somebody said, "Hey, I've got a medicine that can reduce heart disease by 70%," I mean, whoever invented it would be a billionaire, because that would be a total game changer. Right. So check out your local clinics. And I want to throw this out to everybody too that's watching, is that if you can't get to a Kalypso clinic, if you're not close enough, if you got questions, you can call our clinic. You can talk to me anytime. This is what I love to do. You want to hear about how it works, the details of it. I've got a whole spiel. You want to ask about, okay, well, I'm not sure about this doctor that's providing it and what they're doing and how long the infusion is. I'll answer all your questions. I'm not going to charge you anything. I just want people to get educated. I want them to get the treatment safe. And that's kind of my main thing too, is that our biggest issues is that people need to get educated on the treatment. And I want to make sure people get it safely. And as anesthesiologists, again, we use this medicine all the time. Emergency room physicians use it all the time. And so, we know how the medicine works. We know what to expect. And again, just even if you're not going to come see me, call up, say, "Hey, I watched this thing with Dr. Cannon, and he said he talked to me," and they'll get your number, and I'll call you back that day.
Tell him you heard it on the Social UnDistancing show.
Otherwise, he won't call you back if you don't tell him.
Right, exactly. Yeah.
Exactly. Doc, that's awesome. I appreciate you doing that, actually, because I know there's a lot of people who would have questions like that. And I did a search. Unfortunately, there's not one near me here in Illinois where I'm at, and so, but I appreciate the invitation, because this is really Like my mind's blown right now. The whole idea. I think you really just kept adding on to it, and for me, the idea of the what you call it, neurogenesis.
Yep.
Like my mind's just kind of reeling right now, to be honest with you on that. Let me ask you on this, because on the website I saw that there was some treatment available for neuropathic pain.
Mm-hmm.
And does that include neuropathy? My father's in Lubbock, and neuropathy is something that he has to deal with painfully, and so
no, that's actually one of the main things that we treat for it. And so for our viewers, neuropathic pain or neuropathy is usually caused by you have some type of surgery or an injury, and things should get better in a relatively short amount of time, a couple of weeks, a month or two, and it just doesn't. And then you get either several different things, but you can get weird tingling sensations, burning sensations, numbness sensations, and they've got some medicines that try and help with neuropathic pain. They help somewhat, but again, they're supposed to be short-term fixes, not long-term. And/or lots of patients that may suffer from diabetes also get neuropathic pain and neuropathy. So this treatment really helps with that too. And again, the whole point is that one, it's going to block those pain fibers that the body's never been exposed to, and then again, it helps those new nerves, to regrow and really help those patients. And again, we've had patients that have come in and said, I've had neuropathy in my foot, for 5 years, and they come in and get 5 or 6 treatments, and all of a sudden, that neuropathy's gone. And they, like I said, they may have to come back again at 6 or 12 months to get a booster or maintenance dose. But it really helps those patients a lot. And again, these are patients, we're not trying to say that this necessarily shouldn't be a first line treatment. In some cases it can be. Or certainly we do consults with all of our patients and talk to any referring physicians. But again, usually these patients are, hey, we've tried everything that's normal, right? Traditional medicine. And, this is when they come to see us. And, we have.
So if my THC isn't helping me as much, I should call you, right?
Yeah, well, we're going to ask you to stay off the THC for a little bit there.
What? You don't have to worry about that one.
Let me ask this.
In Texas, it's still not legal. So we got to speak the party line.
Sorry for y'all.
Yeah. Let me ask you this, Dr. Cannon. So your formulation is different than, and you guys are looking to get it, what's the word, trademarked or whatever, patented, just from you guys' research. So if we work with a different treatment center, they could have their own mixture or formulation and stuff like that. So is that the case?
Yes, and most of the other ketamine providers are giving, again, what's considered generic or raw ketamine. They may give a low dose of an anti-anxiety medicine maybe beforehand to try and help with, again, kind of the weird effects. But again, not being involved in these other clinics, I don't know, ketamine is definitely the main medicine that's doing all of the heavy lifting. But I can't speak intelligently on what else they're doing or how they're doing it. And that's why we're trying to work with, again, DC to get some regulations on this to get a standard of care so that ultimately everybody we know will get the same safe treatment with the least amount of side effects. And that's the main goal, right? We want to minimize side effects.
Doc?
Yeah. We want to come to San Antonio, but I don't know about staying about 10 days.
Come on down.
I could easily do it. I don't know if my life will function the same after.
Yeah, we have to work though.
Yeah.
That's the problem.
You can set up your studio here. We can come see the Riverwalk, the Alamo. We got the best Tex-Mex food in the United States.
Oh, I know that's right.
It's pretty good. It's pretty good.
So, Doc, I hate to do this. I mean, we're at 53 minutes, and we gotta have to cut it. I hate that.
Yeah.
Because this is so mind blowing.
I talk too much. Sorry.
No.
We love it.
Yeah. Like I can imagine our after show after this. We're just gonna be like, my mind is blown. Like I'm.
Yeah.
I can't even describe it. But I want to finish this with a comment from one of our viewers here who.
Sure.
2 comments. I'll do the last one that she said, which was I was fixing to ask about the diabetes. Great to know. No, sorry, some more comments popping up. I'm going to ask them a couple more. So, are there any long-term side effects from ketamine?
The short answer is no. Obviously, people that abuse it and use it again for partying, recreation. Number one, they're taking nuclear doses of the medicine recreationally, and they're doing it month or weekend after weekend or month after month. And those do show long-term side effects, both with cognitive impairment and sometimes bladder infections. Low-dose ketamine infusions, no data in any medical literature that's ever shown to have any problems long-term.
Awesome.
Okay.
I'm going to go ahead and forewarn all of you guys who are watching us. We definitely are going to go a little bit over the hour mark that we normally have, only because the doctor is sharing some valuable information. And I'm going to wrap it up, I promise, but I just want to get some of these comments in. I think they're important. I know Erin's over here. She's telling us to make sure we bring you back on again. I don't know if we'll bring you back. I think we'll do a supplement video so that maybe we can have some conversation more about more of the benefits and things related to ketamine, because if that's what our viewers are telling us that they're wanting, then I think we got to listen sometimes.
We got to listen sometimes.
Yeah.
Sometimes.
This will be the only time we've ever listened to them. And then so here's the comment that she says, Linda saying, thank you so much for having Dr. Connor on. Cannon. Sorry, Dr. Cannon on. And thank you, Doc, for taking time to share.
You're welcome. My pleasure. My honor.
So, yeah, I guess with that.
Mind blown.
Yeah.
It's like we're supposed to do these things that we do at the end of the show, but man, I'm just like, just soaking it in right now.
Right. My brain is literally firing up because, I mean, some of the stuff that you've talked about, I'm like I said, friends with migraines, friends with, I'm sure it's fibromyalgia maybe on some of them, but the whole diabetes, the neuropathy, the neurogenesis stuff, like I'm just like, what?
And I want to add real quick, we talked beforehand for our viewers when they have their guest on, we always try and keep it upbeat, and obviously to keep this brief, we don't want to try and talk about the coronavirus and the pandemic, but the reality is that there's thousands, if not millions of people suffering from depression and anxiety, and certainly the pandemic and being quarantined and staying at home has not helped that situation. Suicide rates have tripled in the last couple months. Depression hotlines have tripled to quadrupled. This is a medicine that initially was made to help depression and PTSD. And so anybody out there that's listening, if you're suffering from these things, please, please, please give us a call and get help. Go and find a ketamine clinic. I'll help you find one if you can't find one close enough to you. But that was my soapbox, is that things have gotten worse for our patients that suffer from depression, anxiety, and PTSD. And this could be something that could be a godsend for them. So, I want to keep it upbeat too, but hey.
Right.
No.
We appreciate that. Yeah.
The upbeat to the reality is
right.
A very pro mental health home, very pro mental health group here. Right. And so if those are the numbers that are out there, which they are, and you have some solution to that somehow,
right,
please say something. With that, I'm going to give you a few seconds here where you can plug whatever in the world it is you want to plug. And as long as we keep it PG-13, I don't think that'll be a problem. We'd like you to just say whatever it is you'd like to say.
I just want to say, first of all, thanks for everybody coming on to watch. Maybe you're going to watch the replay of this. It's been my honor and privilege to be on the social UnDistancing show. Thanks to the host and the producer for having me on. My plug is that, again, look for help. Our website is calypsowellness.com. Again, as I mentioned before, you can call, we'll give you a free consult. Even if you're not coming to see us, we're happy to help. And my other plug, which we talked about at the beginning, we talked about the treasure hunt. Staying at home sounds like it's a great idea, but staying home, I think everybody admit, kind of sucks. So I want to plug that when it's safe, when your local authorities allow you to, let's get people back outside again. Let's go enjoy nature. Let's be friends with our neighbors, and let's make new friends, because there's so many things that we can still be doing outside once it's safe and we're allowed to do so. And let's not get caught up on our computers, our cell phones, our iPads. I'm guilty of it too. One of the blessings of my day today was that we went outside with my wife and kids, and we just went to water some plants. And the kids are just excited that we want to go out there and do that with them. So when it's safe and you're able to, get back outside. Let's get out and be friends and be neighborly and make it a better place again for everybody.
Perfect.
That's my spiel.
Awesome.
Hey,
Thank you.
Hey, let's get on that question that Carrie asking before
Sure,
before we get to the
the last one question. Okay. Carrie's asking, by any chance, can you speak on the anxiety and depression that comes with a cancer diagnosis and how this ketamine will help that? And do you recommend while someone is taking cancer treatments?
So again, because we're short on time, but we definitely
Take the
treat
time.
patients.
Take the
Yeah,
time.
yeah, it's fine. It's our show. We do what we
Right.
want.
We make
Your
the
show.
This is our show. We do what we want.
the time to answer this.
We definitely take care of patients that suffer from cancer and are actively getting chemotherapy. And so a couple of ways that the ketamine helps is that, again, it's a potent anti-inflammatory medicine, so it helps out with their pain. There's a lot of pain associated with patients getting chemotherapy. And again, just empirically from all the patients we've seen, it's shown that it's decreased their pain levels as well. And then most importantly is that we've seen that the ketamine, again, by it's helping to reset your brain, your attitude, your emotion, your mood, whatever you want to call it, is that even patients we have that are terminal and nothing's going to have, be able to fix them. They've tried surgery, they've been through chemo. They've told us that, hey, this has made it so at least I'm in a better place and I can, function better, spend time with my family, my loved ones, whatever it might be. And because it's a different type of medicine and it's not as long acting and as much of a downer as, again, the morphine type medicines, then patients have a better quality of life, at the end, so to speak, because they're able to, again, interact with family and friends and loved ones. And so in that respect, this could be a great treatment because, again, all the pain medicines aren't working. If you have cancer, I've had my mom die of cancer. I've had other family members have cancer. It's depressing for everybody, especially the person that has it. It's the fear of not knowing what's going to happen. Is it going to get better? Is it going to come back? Do I need another surgery? Do I need more chemo? And ketamine really helps out to give those patients kind of a new perspective. And even if we don't get rid of all their pain, the patient says, doc, man, I just feel like that, I'm in a better place. I feel like that spiritually I'm uplifted. I'm sleeping a little bit better. I don't have the anxiety anymore. I'm able to deal with it. So to answer the question, yes, definitely we treat patients with cancer and we can give the treatment while they're getting their chemotherapy. We certainly always talk to their oncologist first to make sure. Earlier on, I mentioned that anesthesiologists, we've kind of got to know all the different drugs for surgeries. There's one caveat for that. And the caveat is that oncological drugs, they're always new, coming out all the time. And we don't know all of those. The stuff that I learned even back in med school is now outdated. So we always get back to whatever your referring physician is, or we'll call them up directly and say, hey, here's what they're coming in for. Here's our treatment. We just want to make sure, is this going to interact with any of your chemotherapy agents? So we always double check to make sure that it's safe. And we do that for every patient.
That's awesome. Yeah.
Thank Carrie for that question.
The thing that I love is that, you're an actual doctor. It's coming from not just one doctor, but a family basically of doctors and a group of doctors that have done the research that are all involved into it instead of just, I just happen to be a foot doctor and decided to come up with this type of treatment. Not anything against foot doctors, okay?
That's great.
Yeah.
Oh.
Yeah.
We're still blown away. Yeah,
Yeah.
we're in the last question.
Yeah. So, all right, with everything you've said already, like I feel like we do like 3 weeks worth of shows with just everything.
Right, exactly.
I'll keep blabbing.
I know, but we might literally have to come back for a supplemental show maybe and be like, let's add on to this one kind of thing. But for the moment, we always like to ask our guests to give us a topic for future episodes. And so with that in mind, do you have a topic that you can give us that we would be able to cover for future episodes?
I do, and I'm getting something ready for you.
Okay.
So you guys have set this up perfectly. One, your background now is showing the sun, right?
Yeah. You were talking about it, so I had to change it.
Number two, we've had some people ask about cancer and cancer treatments. And so what I recommend is talking with a dear friend of mine who is a PGA teaching professional named Randy Jones, who was diagnosed with terminal metastatic melanoma from skin cancer from the sun.
Oh, wow.
And he has become an ambassador not only for the PGA, but also is, I may be saying this wrong, an honorary, something or other with MD Anderson, one of the greatest cancer fighting centers in the United States, if not the world. And he's got a phenomenal story about how he went through getting melanoma, how he got it taken care of, and then it relapsed, came back even worse, was literally, prognosis was going to die. And I don't know if this picture is going to come through, but the day he finished his treatments, hopefully you guys can. It's not going to come through. Dang it!
Hold on, just
Tilted.
send it to me in Facebook. I'll
All
make
right,
sure
so
to get it shared.
He didn't even know about this, but he sent this picture, and he came out of the hospital, his last treatment, and he's got his arms up like this, right?
Uh-huh.
And I'll send the picture to you, but there's just this weird heavenly glow around him that nobody filtered it. He didn't even notice it until he put it on Facebook, and people are starting to say, "Oh my God, this is so awesome!" And it still gives me goosebumps every time I look at this picture. But the point is that one, he's got a phenomenal story. He's a great speaker, and I think a thing very dear to my heart, because he's a good friend of mine, is that we need to get more education out there about sun safety, putting on sunscreen. The two most preventable causes of cancer in the world are skin cancer and lung cancer. And lung cancer is don't smoke. Skin cancer is we got to do better about sun protection. And when you talk to somebody that's gone through what this guy's gone through, you guys are going to be blown away. So,
wow,
I'll
that is
give you
awesome.
all this information.
Okay.
Awesome.
We'll make sure to collect that from you afterwards. I just put that in the topic in our comments so we could see that. We don't forget exactly what you're talking about. So, all right, Dr. Cannon.
Thank you so much.
Thank you. We appreciate you and your knowledge.
For real.
Thanks for having me on. This is awesome. I had a great time. I appreciate it. Thank you so much.
Thank you for coming on. I think we had a greater time having you here.
Right,
Okay?
exactly.
Yeah.
And we've had plenty, and our viewers are still here. For the ones who started out with us are still here. So it's like, wow, okay.
Anybody wants to talk about dragons and wizards, have me back on.
I'm
We're
gonna remember
down.
that.
That's awesome.
I remember that. So, Doc, we're going to let you go now. We hope
Okay.
you have a great night, or you can stick around for the after show. We'll be back there in a little bit. Thank you again.
Thank you
okay?
again. Yeah, thank you so much.
Yes, thank you, Dr. Cannon.
You're welcome. Thanks, everybody. Yeah, I'll
All
stick
right.
around. See you guys in a bit.
All right.
Bye.
Wow. We're like speechless. And
I mean,
that's really hard for us.
Yeah, because I'm like, let him talk. I'm just listening. I'm absorbing. I'm a sponge tonight.
Right, exactly. Man, so the producer and I will probably have a lot of conversation tonight, so it's gonna be really
Hey,
cool.
I'm texting people. I'm like, hey, y'all need to watch this on the replay. You need to I'm tagging people because I'm like, there's a lot of people that I know that are affected by this stuff and need to know that this is available. You know,
Right.
honestly, I've always said a pill it's just a Band-Aid. It's not treating anything. You're just going to be a repetitive customer to that pill. And then when that doesn't work, you're going to get something else.
Right.
And if it can help you, and how many sessions, 3 to 4 to 5 to 6 sessions at the most, I mean, why not? You know, why not give it a shot?
Right.
It's just amazing to me.
Exactly. Mr. Penny, you okay?
Yeah, I'm really like, you guys, I wish I could explain it better to you all, but I can't. But just neurogenesis is something far-fetched to me, and knowing the pains that have with that in my family, I'm just like, if this can provide something, it's a matter of convincing people,
Right.
you know, like my father or whatever, and seeing how this can help them out, because yeah.
Good stuff. It's good stuff.
Mhm.
Well, we definitely want to get to the after show, so we need to end the show.
Yeah.
Right. Good night.
So everyone, come and join us tomorrow night. Tomorrow's Wednesday. We have a fantastic guest coming on. I've called it more of a spiritual sister to the Social UnDistancing show. It's not exactly the same thing, but in the heart of how to transition during a new normal, this person has created something on Facebook to help out local businesses here in Bloomington, Illinois, and she's going to be coming on the show tomorrow. Her name is Rendy Bradshaw, and she's going to be sharing with us what she's done. And I hope you all can come and join us tomorrow and learn about that. And if you can take anything away from it, maybe you'll figure something out for your hometown.
Right.
Cool.
So thank you. And everyone, I appreciate y'all. And as usual,
Remember to wash your hands.
for at least 20 seconds.
You filthy animals.
Good night, everybody. Thanks for joining us.
Have a
Appreciate
good
that.
night.
Hit us up on the replay.
On the
Definitely.
replay. This one needs to be replayed by a lot of people, I think.
Yeah.
I'm gonna pin this to the top of our page, and I'm gonna share it
please do.
like
This is
several
amazing.
times.
Yeah.
Yeah, because this one's the one that got me like, what in the world?
Yeah, like he's not talking. That's a big thing.
I mean,
I think Black Raven would totally love this episode. There was not a lot of giggling.